Hello and welcome. In today's episode of Dr. Nora, I take you through everything you need to know about jawline slimming. Before we get started, let's talk about why our jaws sometimes looks a bit squared off, or it looks a bit more bulkier than, say, your average person on the street. This is primarily due to a condition called Bruxism, which some of you may have or you may not be aware of that you have it. But essentially what that means is perhaps when you're sleeping, or perhaps not even in your conscious mind, you start grinding your teeth or clenching them down really hard. And that repetitive movement, just like going to the gym, for example, when you're building up muscles and getting those biceps nice and big, that repetitive movement actually gets that muscles quite excited, and you end up doing a bit of a workout to the muscles called the masseter muscles, which are your main muscles for chewing. So let's do an experiment right now. I want you guys all to have a feel of your jaws over here, and use 2 fingers. And I want you now just to clench down and relax, and clench and relax. And you should all feel that there is a muscle there that sort of bounces up and down. Now, some of you will have a super strong masseter muscle, and that usually is an indication for those of you who may be suffering from bruxism, or when you're clenching too hard or too much during your sleep or subconsciously. And some of you may not have such a strong muscle, in which case jawline slimming may not be the treatment for you. However, those people who've got a really strong masseter muscle may also be experiencing symptoms such as headaches around the temples. Maybe they get some ear discomfort, maybe some jaw discomfort as well. Maybe when they open their jaw up, it feels really stiff and uncomfortable. And that's generally because that muscle is so large, or hypertrophied is what we call it, so that you've been working it out so much that it becomes really large, and it can impact you in other ways. Now, not only does bruxism affect your muscles by making them super large and super big, but also the act of grinding your teeth or clenching at nighttime, or particularly when you're not really aware of it, actually causes damage to your teeth as well. So it causes the enamel of your teeth, that nice layer that protects our teeth, to start to erode and wear away. Now, unfortunately, enamel is irreplaceable. Once we lose it, we lose it. And so it's really important that if you do suffer from bruxism, or you think you suffer from bruxism, that you do get a dental assessment to make sure that you haven't gone into the stages of enamel erosion. In other situations as well, if you are clenching a lot, you may end up with really fine cracks in your teeth. And well, teeth can be replaced, but obviously not with the real thing. So there is loads of symptoms associated with bruxism. So if you yourself think that might be yourself, please go and see a doctor for your full assessment. But the good news is, if you do think that is you, and you think, hey, you know what? I've noticed that my jaw has become such a boxy looking shape. I never used to look like that, and I don't like it. And certainly we see this, and I see this a lot in practice, where patients will come in and their jaws just look a lot more boxier. For example, they may even be protruding outwards, and they just look a lot more boxier from the bottom, and they don't have that nice sort of, or that diamond shape, particularly in females. They don't have that diamond look of the jawline. And so we can talk about treatments that we use to help them and to help to reverse this appearance. And the treatment I'm going to talk to you guys about today is anti-wrinkle treatment. Now, not just talking about anti-wrinkle treatments to the forehead, the frown, to get rid of those lines. No, we are talking about actual anti-wrinkle treatment to reduce the appearance of this muscle, to settle it nice and down so that it doesn't look so bulky, and also has a really nice knock-on effect for those symptoms of that jaw discomfort, that earache, those headaches, and so on. But Dr. Nora, before you get cracking with all of this, who came up with the idea of using anti-wrinkle injections into the masseter muscle? Well, this is a really interesting story. So back in 1990, the first case of this was actually seen in Belgium, where there was a chap who unfortunately had a car accident, and he was placed in a coma. And the doctors noticed that he was making a lot of noise whilst he was asleep. And they realized that he was making a lot of noise because he was grinding his teeth, and it was actually disturbing all of the neighbors surrounding him, so the patients that were his neighbors, and they were all complaining about the noise. And so what they decided to do was, they thought, well, hey, how about we put some anti-wrinkle into the muscle of the masseter, and let's see if that works. And so that is the first case of the use of anti-wrinkle treatment in the masseter muscles, and lo and behold, it did work, and the patients around him got a much better sleep, and he wasn't grinding so much and not making so much noise. So that's a tip for you guys out there. If you have got a partner who can hear you grinding away at night time and is like, you know what, there's something wrong with you, or what's going on there, maybe it's worthwhile suggesting for them to go and see a medical doctor as well to have a discussion. So where is this magical muscle that we have? Well, we know that on our surface anatomy. If you press down and we clench down, we can feel it and it bounces up and down, particularly if you've got that really strong muscle. But how do we know where to inject and what to do? So as practitioners, now obviously it's really important that when you do go and see somebody, they know exactly where they're going, because there can be some complications that can occur if they inject the anti-wrinkle into the wrong place, which we know from previous episodes, we definitely don't want to be doing that. But in saying that, we know that we need to inject into the masseter muscle, which is this bulky muscle to the side of our jaw over here. And we know that the safe zones to inject into it is if we have a feel or palpate the muscle, we can feel that actually if we clench down, that there is what we call the anterior border. It sort of curls around and you can feel that sort of anterior border where it curls around, and the posterior border or the back of the muscle is actually defined by the angle of the jaw. And then going down, we can also feel it over here, just at the angle of the jawline here. So we know that posteriorly, it's from over here, you can see here, and inferiorly, it's at the angle of the jaw, and then anteriorly, you can quite easily feel it if you are clenching. You feel a nice curve motion. But what about superiorly? Well, we need to make sure that we're going into the safe zones when we are injecting. And so generally cosmetic practitioners will draw a line to make sure they're going in the right places. And usually that line superiorly will go from the tragus, which is this part of your ear over here, down to the corner of the mouth. And so we draw a line, or we have a look for an imaginary line, and then we know that this is our safe place that we can inject our anti-wrinkle treatment. Now, usually the cosmetic injector will put about 3 or 4 injections, depending on their technique, into that bulky muscle. And that is to say that you may need a fair bit of anti-wrinkle into that muscle, because it is such a large muscle, and it does depend on your particular situation, but the number of units that you use may need to be quite substantial for you to get an impact. And certainly treatment does, just like with any other anti-wrinkle treatment, it takes time for it to start working. And we know that because the way that it works, unfortunately, it just takes a little bit of time because the muscles are contracting. And so what anti-wrinkle does is it stops those muscles from communicating with each other. And so eventually they don't have that strong grip. And we know that with anti-wrinkle treatment into the masseter muscle, it reduces the grip strength by about 20 to 30%. And so it takes up to about 3 to 6 weeks for it to start working, because it is such a big bulky muscle. But the good news is when it does work, oh my goodness, it is a life changer. It will hopefully last you up to anywhere between 4 to 6 months, depending on your own individual factors. And I literally have a list of patients that will come back every 6 months on the dot and say, "Doctor, my jaws are getting thick again. I feel really tight and my ears are tight. I've got headaches again. I can just feel myself being stressed. I'm so chunky down here. Please, I've noticed my jaw is super large now. I want to get it nice and diamond again." And off we go again. And every 6 months, it is so life-changing, which is really good. And then the net impact of that as well, not only does it give them some nice medical relief in terms of their symptoms, but over time, what you notice is that the jawline actually looks a lot slimmer, because that big bulky muscle is no longer big and bulky, and it reduces down, and actually you notice that the profile of the jaw becomes a lot more of a diamond shape. Now, obviously, this does depend on personal factors. Certainly for women, this tends to be a popular treatment because women tend to want that sort of diamond face structure. Men, on the other hand, and I have heard this is true, men, on the other hand, like to have that more sort of squared, defined jaw. And one of the trends that is going around right now is that men are trying to make that muscle actually a lot bigger. And they do this by chewing gum. Now, as we said before, like any muscle, when you work out in the gym, it's going to get bigger. And so when you are working out that muscle by chewing gum, you are going to increase the size of it. Now, I'm not necessarily saying go off and do that if you want to do that. There are other ways we can make your jawline more defined. But certainly that is a trend happening right now, is that some people actually want to make that muscle a lot bigger, to make it a bit bigger and bulky, and to get that nice definition of the jaw. So each to their own at the end of the day, but certainly if you are suffering from bruxism or you want to get that nice slimming of the jawline, that certainly is an option to consider. So Dr. Nora, that sounds really fantastic, but what can go wrong? Well, guys, as we know from all of our previous episodes, there certainly can be some complications that can occur as a result of anti-wrinkle treatment. So that is why it is imperative, and I mean imperative, for you guys to seek the advice of an adequately trained cosmetic practitioner who knows their stuff, who knows what they're injecting, where they're injecting, to reduce those complications as much as possible. Briefly speaking, you might expect some local irritation to the skin, maybe some bleeding, maybe some bruising that may occur, and generally this does tend to settle down. in some rarer circumstances, and hopefully this won't happen to you because you're going to someone who knows what they're doing, the product itself can travel to a surrounding muscle, and that can lead you to have a bit of a crooked smile. So unfortunately that isn't the best outcome, but the good thing is it's not permanent and it will settle down after a few weeks. But that is why it's super important for you to seek a doctor or a practitioner who knows exactly where they're going, so that they don't inject inadvertently into the wrong muscle and then cause you to have a bit of a wonky smile. Not cool. So there you have it, a brief overview of the use of anti-wrinkle treatment for jawline slimming and for the treatment of bruxism. Now there are other options out there if you guys are suffering from bruxism but you like the shape of your jaw. Now you might want to seek some other treatment, and generally speaking other treatments that we have available for you guys is using a mandibular splint, which is what you can get from a dentist, and this is essentially a night guard or a mouth guard that you wear at nighttime whilst you're asleep. So rather than you pressing on your teeth and damaging your enamel and getting those fine cracks, you're pressing on the guard itself, so it's helping to save your teeth. In other situations, if you don't quite fancy those options, then you can also seek the advice of a specialist physiotherapist who does deal with the dysfunction of the jaw, and that can help you also with some relief. And finally, if you do suffer from bruxism when you are grinding at nighttime, a lot of the reasons is down to stress. So have a look at your own lifestyle and just work out, is there something in my lifestyle that could be contributing to this? Am I feeling particularly stressed? Is it an exam that's coming up around the corner? What is making me feel this way? And you can address that with your local doctor to hopefully help you work through it. Okay guys, so there you have it. That is a quick brief overview of jawline slimming with use of anti-wrinkle treatment. I hope you guys have found that video useful, and of course if you have any questions or comments, please don't hesitate to drop me a line in the comment section below. But for now, take care and stay healthy.